that codes of ethics and standards of conduct are a good line of improvement to pursue, and I welcome your determination to do it. And I accept your commitment, Mr. Ackman, that you will, in fact, implement changes in the way that your company does business. For me, the real question is, how do we prevent other companies from going haywire, from the profit motive, from going out of control, and frankly, corporate greed from eclipsing social responsibility? That is perhaps a very stark way of describing what happened here, and I say it because all of you have acknowledged that what happened here shouldn't have happened. Am I correct?
Yes, I think I have an answer to the question.
You have answered that question.
No, and I have just to, I think this has been a very effective committee in a relatively short period of time, and I think the point I made before, while raising the prices of these drugs increased the profits of Valeant, it destroyed enormous shareholder value, and I think that's if you look in the stock market today, drug companies that have done similar things, and by the way, Valeant is an example. Unfortunately, there are many others, and there are companies, frankly, that have more of their business model is about raising price. The stock prices of those companies has declined dramatically, and that incentive will incentivize the managements of those companies, who are largely compensated based on how their stock prices do, to adopt more ethical pricing practices. So I think you've begun to accomplish that mission.
It destroyed shareholder value. It also gravely damaged individual lives, as we've heard today, and it impacted health care for countless other patients. And this phenomenon of skyrocketing pharmaceutical drug prices is impacting the quality of health care in our country. And just to give you one example, these skyrocketing price increases for Isoprel and Nitropress have forced Yale New Haven Hospital's pharmacy department to consider cutting other drug expenditures to make up for the cost increases, since these two drugs are the gold standards for treatment, and there are no really acceptable, or at least preferable, alternatives. And for 2016, Yale New Haven Hospital estimates it will spend nearly $2.5 million on these two drugs, which could be spent on health care for other individuals. So the ripple effect is widespread. My question really is, what should the government agencies have done here? How did they fail? Because the idea that the pharmaceutical drug industry is a free market clearly is a fiction. There are regulatory agencies that, in fact, impose regulations here and rules and standards that should have prevented this kind of egregious or extreme misconduct. And if it's not within their purview legally right now, it should be. And so that, for me, is the challenge for this committee, to make sure there are oversight mechanisms and standards and rules that would preventively act against what happened here. I want to ask about two drugs that I don't think you have, the two other drugs that I don't think you have mentioned would be reduced in price, Coupermin and Cyprin. You intend to reduce those prices as well. I know you committed that you would have a board meeting tomorrow and you'd recommend to the board that Nitropress and Isoprel be reduced in price. Will you commit to the other two?
That would be my recommendation.
And Mr. Pearson, maybe from your perspective, what could or should have been done by government agencies to prevent, in effect, your very excessive price increases here?
I don't have any great suggestions for government agencies. I do believe the markets do work. I do believe that the dramatic decline in the value of Valiant will make it. People are going to give a lot of thought to any kind of significant price increases. The asset values of companies that have older drugs will go down, and it won't cost as much to buy them, and therefore there'll be less. So I do think the market forces will work, and the capital markets will, and I agree that this committee's played a huge role.
Mr. Ackman, do you have any?
Yes. I think part of the problem is, and again, I'm not blaming any individuals, but the approval process for generic drugs is a too prolonged a process, and it's too expensive. And the impact of that is when you've got relatively small drugs where there's not enough revenues to justify a generic alternative, particularly in light of the duration of the FDA process and the expense, you don't see the competition come in and bring down the price. So if we could streamline the process, I think the other impact is there's been a lot of consolidation in the generics business. And I think the consolidation is driven by the same factors. You know, if it's incredibly expensive to get through the FDA to get generics approved, it forces companies to consolidate to get scale so that they can be competitive. I think if we could bring down the time and the cost, and if we could, you know, look, if I wasn't doing what I'm doing now, I think this is a very good time to launch a generic company because of the consolidation in the sector, and I do think there's an opportunity, but you need a lot of capital to start a business to compete against the big generic companies. But I think that would create the market competitive forces to address the problem.
Well, I would just suggest monopolistic or predatory pricing taking advantage of a monopoly is against the law, and maybe more active antitrust enforcement in this area would be appropriate.